Have you ever felt like your heart was about to burst out of your chest, your breath was caught in your throat, and the world was spinning around you? If so, you might have experienced a panic attack. These intense episodes of fear can strike anyone, anywhere, at any time. But don't worry, we're here to help you understand and recognize the signs. Imagine you're in a crowded mall, surrounded by the buzz of shoppers and the glare of fluorescent lights. Suddenly, your heart starts racing. You feel a tightness in your chest and your palms begin to sweat. Is this just stress, or could it be something more? Let's dive into the telltale signs of a panic attack. First up, we have the physical symptoms. Your heart rate skyrockets, pounding so hard you can feel it in your ears. It's like you've just run a marathon, except you haven't moved an inch. Along with this comes rapid breathing or hyperventilation. You might feel like you can't catch your breath, gasping for air as if you're underwater. Next, you might experience chest pain or discomfort. This can be particularly frightening, as it's often mistaken for a heart attack. While it's always best to episodes, in bipolar disorder, manic or depressive states typically last for days, weeks, or even months. It's not a rapid shift, but more like extended periods of extreme moods with relatively stable periods in between. Now, let's shift gears to borderline personality disorder, or BPD. If bipolar disorder is a roller coaster, BPD is more like a chaotic carnival ride. People with BPD experience intense, rapidly shifting emotions that can change multiple times within a day or even an hour. They might go from feeling okay to angry, then sad, then anxious, all in the span of a few hours. One of the hallmarks of BPD is an intense fear of abandonment. This fear can lead to unstable relationships, with cycles of idealization and devaluation. One moment, a person might be put on a pedestal, the next, they're seen as worthless. This instability extends to self-image too. People with BPD often struggle with a sense of who they are, leading to frequent changes in goals, values, and even sexual identity. So how do we tell these disorders apart? Let's break it down. First, look at the pattern of mood changes. Bipolar disorder involves distinct episodes of mania or depression lasting days or weeks. BPD, on the other hand, features rapid mood shifts within a day, often triggered by interpersonal events. Second, consider the nature of the mood changes. In bipolar disorder, manic episodes often involve decreased need for sleep, increased goal-directed activity, and sometimes psychosis. These aren't typically seen in BPD. Instead, BPD mood swings are more reactive to environmental factors, especially in relationships. Third, examine the stability of relationships and self-image. People with bipolar disorder generally maintain a consistent sense of self and stable relationships when not in an episode. Those with BPD struggle with chronic instability in these areas. It's also worth noting that while both conditions can involve impulsive behavior, the motivations differ. In bipolar disorder, impulsivity is often tied to manic episodes and the pursuit of pleasure or goals. In BPD, impulsive actions are frequently attempts to cope with emotional pain or fear of abandonment. Treatment approaches for these disorders also differ. Bipolar disorder is primarily treated with mood stabilizers and sometimes antipsychotic medications. Psychotherapy is helpful, but usually secondary to medication. For BPD, the opposite is true. The gold standard treatment is psychotherapy, particularly dialectical behavior therapy, DBT, with medications playing a supportive role in managing specific symptoms. It's crucial to remember that these disorders can co-occur, and some people may have symptoms of both. This is why professional diagnosis is so important. If you or someone you know is struggling with mood instability or relationship difficulties, don't hesitate to seek help from a mental health professional. Understanding the differences between bipolar disorder and borderline personality disorder isn't just academic. It's the key to getting the right help and support. By recognizing the unique patterns and challenges of each condition, we can better support those affected and work towards more effective treatments and management strategies. Remember, mental health is just as important as physical health. Whether it's bipolar disorder, borderline personality disorder, or any other mental health condition, there's no shame in seeking help. With the right diagnosis and treatment, people with these disorders can lead fulfilling, balanced lives. Let's continue to educate ourselves and others, breaking down stigma one conversation at a time.